Hello and a very warm welcome. We have with us Prime Minister's Special Assistant for Health, Dr. Zafar Mirza. At the moment, in Pakistan, there are more than 200,000 people who have been affected by COVID 19, and more than 4,000 people have been killed due to COVID 19. We will ask Dr. Zafar Mirza what is Pakistan's plan to curb the virus, and why is it that Pakistan is testing such few people, because they have the capacity, and they made an announcement that they have a capacity to test at least 50,000 people, but we have never seen Pakistan test more than around 31,000 people. Dr. Zafar Mirza, thank you so much for joining us on this interview. I mean, my first question to you: Sindh said that they have capacity to test 18,000 people, but they have only tested something like 12,000 people. Then Punjab said that they can test many more people, but they have not yet ever crossed 12,000 people. So why is it that you have the capacity to test more people, but you're not doing it?
First of all, testing, I agree with you, needs to be increased and continue to be increased. Secondly, Pakistan, when we started in mid March, we had a very limited capacity of testing. We have come a long way. Uh, we started with 450 tests per day. Today we are 20,000 plus at any given time. If you look at last couple of weeks, we went up to more than 30,000. Our capacity, however, is more than 60,000 a day. Why we are not being able to do this? There are multiple reasons for this. First is that over last 2 weeks especially, people are turning up less for testing. Why they are turning up?
They're reluctant to test?
Why they are turning up? It has also multiple reasons. One of which is that people are also learning that if they have mild signs and symptoms, why to spend money? If it will go away because majority of the people recover. From this reason up to this reason, that people are afraid and scared. So multiple reasons, but also it is one thing to generate or establish a big infrastructure for testing, but it is another thing to actually have enough human resource to run all these
What are
labs.
the challenges that you are facing when you say that you do not have enough human resource, that there are no trained doctors, there are no trained
No, no,
nurses?
because you see, it's a very special test,
All right.
and it require a basic safety level of labs, and you need very trained personnel, technicians who have to. I mean, when we started in mid March, we had 3 such labs in Pakistan. Today we have more than 125 labs which we have established over the last couple of months. But it's one thing to establish hardware, but the software, I mean, human resource, and that takes time. And
What
that,
is your hope? What do you hope to achieve? Because I mean, it seems like COVID 19 is here to stay. What do you hope to achieve?
to be honest, by end July, I want to see more than 100,000 tests taking place every day.
But what is realistic?
No, it is realistic.
It is realistic?
Yes, absolutely.
So you feel that you will have more trained people by the end of July?
Yes, we have done major recruitments. We have also, looked at what are the obstacles in the way of these labs running optimally. One shift? Can we do 2 shifts? Can we do block testing? Can we do? So there are actually tomorrow we are once again revisiting our whole testing strategy, that where we have to make few changes in order to increase the numbers.
Now, with COVID 19 and the tests that you're talking about, what is your assessment? Where is Pakistan in terms of the curve? Are we going up? Are we going down? Are the tests, I mean, there's no way of saying where we are because there are such few tests. You said yourself you need to do over 100,000 tests. Are cases multiplying?
Yeah. Okay. And the thing is that we are in better place than 2 weeks ago. Not only in testing is one thing.
But the
Testing,
cases have gone up from 2 weeks ago.
yeah, but the suspected cases have gone down. The positivity has gone down from 22% to 15%,
All
meaning,
right.
yes, deaths have gone down. People going on oxygenation, low flow or high flow or ventilators are gradually going down. So we are definitely in a better place where we were 2 weeks ago.
Are we heading to the peak?
Um, Maybe we have passed, maybe we are heading towards it. I think next couple of days will determine this. That if this trend continues and continues to stabilize and decline, maybe then we have passed the peak.
Do you think that the smart lockdown has worked? Because especially Sindh has been saying that when they do impose a smart lockdown, they cannot contain people in their neighborhoods. They go from one area to the other area, and then doctors say, how do you know that this area is a hot spot? Simply because you have not done the test, so you do not know.
So first of all, uh, we believe that smart lockdowns is the way for the future. If we have to live with the virus, this is the only way that you find out hotspots, you cordon them off. And having said this, it is not just enough just to circle those areas and put police nakas there and you just close them. You have to do many other things. You have to trace the contacts, you have to implement the SOPs, you have to, continuously monitor the situation. You have to also control exit and entry into these
And we
areas.
haven't been able to do that.
And there is a lot of diversity, let's put it this way. But gradually, as we are moving ahead, we have more than 500 for 550 around about different lockdowns at the moment in Pakistan. And with every passing day, we are learning and we are improving our management of these lockdowns. And the most important thing is that we also need to be able to demonstrate that uh, before and after effect, that what was the situation before, how it helped us to reduce the spread of the disease, and when you ease the smart lockdown, what difference it has
So
made.
for Pakistan, I mean, there is Eid coming,
Yes.
another festival coming. Is a complete lockdown or a curfew off the table? That's not an option. Pakistan will only go forward with smart lockdowns.
For governments, Manize, nothing is off the table. There are always policy options depending upon the situation, depending upon the circumstances, depending upon the real threat perception, relative risk.
But the Prime Minister is very much against lockdowns. So,
Yeah, he is. And to be honest with you, I give credit to him. Actually, if you think about it, starting when we delayed the entry of the first case in Pakistan, we had on 26th of February, our stabilization has started before other countries. There must be some consistency of policy here. And actually, from the beginning, he had been saying this, that try to find out ways where we can continue to run the economy as at the same time you are able to reduce the spread of the disease. And eventually, the TTQ strategy, which was launched on 24th of April, and now the smart lockdown, are the results of that guidance. When people say that there has not been a consistent strategy, I absolutely disagree with it.
but also the Prime Minister kept saying that the peak is going to come in July and August. Now,
Yes.
your assessment is that we may have crossed the peak. And you also said that the monsoons are coming and the monsoons may kill the virus or may kill the spread of the virus, may reduce the spread of the virus. So on the one hand, there is Asad Umar and Prime Minister saying there is going to be a peak in July and August. On the other hand, we have Dr. Zafar Mirza, who is an expert on the issue, who says no, there's going to be a monsoon.
It's
we
not
may have
either.
crossed the peak.
It's not either or. When Prime Minister said that we might have peak end July, early August, what do you think? Why he said this? Who told him to say this?
You, I'm assuming.
All of us.
Yes.
I mean, we have three groups which are working on projections. It's a big science, and we have really worked hard on this. So obviously, our predictions were indicating towards end July, but then all other measures which we have, some of those who are man-made, our policies, some of those which we may not understand even. Sum total of all these have led us to a situation there where it seems like that we are stabilizing. So we are actually stabilizing much before than what was projected. I hope so, touch wood, that it continues.
Right.
But it's not he was saying this and I was saying this. We were all saying this, but things change, things evolve.
It's a very difficult situation, and it is a evolving virus also.
Absolutely.
Uh, you know, people are very concerned about their children. There has been a death of 11-year-old Mariam in Punjab. That has been the first child that has died of COVID-19. There are also reports that children are going to be adversely affected. There is a special disease, Kawasaki disease, where children are falling prey to that. What is your assessment? How is this disease going to affect children?
Well, nobody is absolutely excluded in terms of vulnerability. So definitely, the large proportion, let's say 3/4 of the patients who develop the disease and who end up in the critical care, they belong to a higher age group, more than 50, 60. But it does not mean that children, young people, middle aged people cannot have it. So, all across the world, there have been reports of children also having COVID 19, young people also developing COVID 19. Uh, so, as far as the possibility is
Can it
concerned,
be lethal for children? Is it rare to be lethal for children?
it's quite rare. Quite
And-
rare, but not impossible.
And you said something very important. You said children can also be carriers of the disease.
Like
which means
anybody else.
that they can transmit, but only if they're symptomatic, not
Yes.
if they're asymptomatic.
Yeah.
If they're asymptomatic, then they cannot be carriers of the disease.
No, no, no. If they are asymptomatic, they are carriers of the disease.
They are?
But they are. There's a less possibility. I always say that an asymptomatic patient or asymptomatic person, I should say, because he's not a patient, it's less likely for that person to spread in comparison with somebody who has
Symptoms.
frank symptoms, coughing, sneezing. Every time you do that, you are passing
Right.
viruses in the environment. But if you're not coughing, if you're not sneezing, the only possibility remains is that you speak loudly, and maybe a few viruses go out.
Yeah.
You see, it's a common
Right.
sense thing.
Well, another question is, when are you going to regularize the price of the testing kits for the private sector? And you have made a decision already. What is that decision?
Well, we have to, because first of all, we don't want to meddle too much with the private health sector. But when you have a health emergency situation, the government has to intervene. So in Islamabad Capital Territory, we sat down with them and we thought that this is the best way to go about it. We took all the labs on board. We discussed with them, and there was a general agreement that we can cap the price. Capping means setting the ceiling. That
maximum
maximum. You cannot cross that, but you can always go down. So in ICT, we decided about 6,500. Other provincial healthcare commissions, some of them, I recently had a meeting with all of them, and they were also indicating that they are thinking on the same lines. I don't have the latest information, but they were all thinking on the same lines.
My very last question to you, we are looking at this COVID-19 as being something that we will have to live with. You have also said that there will be another peak. Will Pakistan be rid of COVID-19 this year, or do you think there will be another peak in the winter months? Where are we headed for the next 1 year?
Well, if you go by the other countries and their experiences, look at Iran, UK, couple of US. So it is highly unlikely that by the end of this year we will get rid of it. We will be continuing with it. There will be ups and downs, crests and troughs, as we say. And I, I think what is expected is that there will be a vaccine next year, maybe by mid next year. By then, maybe we also have a better treatment. So these are those things which will actually make a difference. But until then, if we lower our guards, as we say, and we stop practicing physical distancing, stop,
Social distancing.
yeah, we stop using masks. We start, we.
So no Eid parties this year, is what you're saying, and no big weddings this year.
Yes, no.
All right. Thank you very much, Dr. Zafar Mirza, for speaking to us. So here was Dr. Zafar Mirza saying there will be no big Eid parties or big gatherings, at least this year. He said that due to the monsoons, he hopes and he prays, and there is an assessment that basically the COVID-19 spread will be reduced due to the monsoons. And he also says that Pakistan will increase its testing capacity as time moves on. Thank you so much for watching this interview on Voicepkdotnet.